Nursing staff, people in healthcare in general were afraid. My staff in particular, their mindset is if we start taking these patients, we're going to quit. We're going to quit because we don't have adequate PPE to care for these patients. And although I didn't want anyone to quit, and I understood why, because these healthcare professionals, their mothers, their fathers, their sisters, their brothers, their sons and daughters, and they have high-risk people that are very, very close to them. And when you don't know what you don't know at that time about COVID, there is some fear and there's some panic. So that was the greatest concern and probably the worst moment.
और हम अपने लीडर साहबान को और अपने नेताओं को, सरकार को ये बोलना चाहते हैं कि आशा वर्कर जो है महकमे की रीढ़ की हड्डी है, आगे लग के काम करती है, ग्राउंड फ्लोर पे काम करती है, तो वो आशा को अपना महकमे का अंग मानकर आप उसको तनख्वाह लगाओ।
And the pandemic has just shown us how staff are really they're just not well looked after. They're expected to sacrifice themselves, and then when they burn out, the people running hospitals just say next, and they'll fill those shoes with somebody, and they don't really care about their staff. So the staff who go into healthcare with all the best of intentions and the most noble ethics soon get sort of beaten down by that system, where they're being compromised in what they can do.
आशा को आपने आम लोगों के इलाज के लिए रखा है, तो आम लोगों को आशा वर्कर जो है हॉस्पिटल में लेके जाती है, लेकिन वहाँ पर डॉक्टर नहीं होते हैं। अगर डॉक्टर है तो उसके पास कोई सामान नहीं है, अगर सामान है तो स्टाफ नहीं है, स्टाफ है तो दवाइयाँ नहीं है। इसलिए आम लोगों को सेहत सहूलत जो है ना के बराबर मिल रही है हमारे इंडिया में।
As we all talk about the healthcare system of the people, government and the leaders have to focus to educate the people or make them aware of the consequences of the pandemic. This virus is impartial. It affects the whole classes. Both the poor and the rich are the victims of this pandemic.
This virus doesn't discriminate. This is not a blue virus. This is not a red virus. This is a global pandemic.
Well, there's two things. One is people before profits. Because in most of the world, they have let profits dictate their decisions more than people.
If I had a message to send to our world leaders about how they should strengthen public health systems so that we're better prepared for the next pandemic, I would heavily encourage them to look at the playbooks that were utilized from state to state from this situation, and I would encourage them to take a look at what supplies did we need the most. And it wasn't just ventilators. It was oxygen, it was chest tubes, it was inhalers, right? Because this was a respiratory virus, when we were treating patients who had shortness of breath related to this virus, typically we would give a breathing treatment. Well, we had to not do breathing treatments and we had to utilize inhalers. So making sure that we have the appropriate amount of medication available for these kinds of things, visiting with drug companies, visiting with PPE companies, visiting with all of our potential resources to make sure we have everything we need to be successful.